Good afternoon, Rotarians. We're going to wait for a second because our speaker and his wife are there and talking. Okay. Now, how does this turn on? The side, right? Good. Perfect. Look at zooming. I like Chris. Good to see you, Chris. You can't see me. I guess I have to stand right here. Okay. I don't know if I like this position, this side. They'll be able to see me from here? Okay, good.
It follows you.
It follows. Hello. I just want to make sure. Everybody, welcome to Westwood Village Friendly Rotary Club. And my name is Benjamin Fisher, and I'm the president, just in case you don't know.
Fun numbers.
Okay, got it. Welcoming to those zoomed in, Marcia, Chris, Terry, and Mike Newman. Welcome. Good to see you, Marcia. You feeling good? Good, perfect. Fine. I have to pay that. Our duty here is the magic road. And we're going to have a lot of magic related. Now, by the way, everybody, those of you who are filling out this survey, this is where the magic begins. We're going to take this information, assimilate it. We're going to put new projects that each of you want to do and some suggestions. I'm really open to changing this. Again, I am just the leader. I am not, and everybody else in this room is a leader. So it's not just me. Remember, it takes a village to make it all happen. Four-way test. John O'Kee. Now, wait, are you good? You can go. Okay, good. So would you read it? Let's find out your
A four-way test
Okay.
of the things we think, say, or do. Is it the truth? Is it fair to all concerned? Will it build goodwill and better friendships? Will it be beneficial to all concerned?
Thank you, John O'Kee. Everybody get John. You get bonuses. Oops. Janet, thank you so much for bringing the grader and also making sure that everyone got this new survey. Jim Crane is going to lead us in the Pledge of Allegiance. Could everybody stand up? The flag is over in the corner over there. And go over. Pledge allegiance to the flag. States of America. To the republic. One nation. Thought of the day.
This is a short one. It's a quote. I've missed more than 9,000 shots in my career. I lost almost 300 games. 26 times I've been trusted to take the game-winning shot and miss. I failed over and over in my life, and that's why I succeed. Buddy, know who that is?
LeBron Michael Jordan.
Michael Jordan, thank you.
There's actually a second version to that too.
I don't know, it's just.
Thank you, Gordon Bell. survey discussion. So in lieu of the song of the day, as you can see, Ed, actually the first meeting that I've been in, that Ed hasn't had a song. I'm not going to improvise and sing, but I wanted to have a discussion of the survey.
You can sing.
I think you better not it. You can sing if you want. I don't know. Would you like to sing by yourself? Okay, then we're not. No. You see, oh, you see?
I see what's going on.
You understand that I brought ammunition. First lady, I'm on the bunch of. So let's talk about the survey and what it means. We were in a board meeting a few months ago, and we were talking about what will the club, what will members in our club want to do? If they like what we're doing now, is there any suggestions? And Tom, I know it didn't come out the way you want, the lines didn't line up, but the thoughts, I want to thank you for putting this together. And the information, is everybody give Tom a number? Thank you. So the survey is going to be the roadmap of how we're going to go in the future. Talks about membership, it talks about activities you want to do, and most importantly, this year is all about fun. And I think we're going to need more social events. So those are some of the things you can put down. We also have young members now, Sam and Val, and they asked me, everybody, let's give them applause. Val asked me, how do we go about getting young members? And I said, tell me, how would we go about getting young members? So the burden is now on them. We'll have to support them, but I don't have all the answers. So looking forward to that discussion, okay? Social media, you're on. Tom Barron, you're all over the place. Thank you for doing the windmill. You're welcome. Visitor Rotarians. This is my pleasure. I want to introduce my first lady, Susan Fisher. Please stand up. It's enough. Okay. And then I want to introduce our speaker and his wife, Michelle Brones and Eileen Brones. Thank you so much, guys. And then Bob, would you introduce yourself?
Santa Barbara, Fullerton, and Seoul, West Virginia.
Yes. Is there any other guests that I haven't? I don't see any other guests, so we can meet one. And by the way, let's everybody, this is not on the slide, it's just recently happened. Phil Gabriel became a new grandfather. So let's give it to him. Give it up. So Terry, fine Phil for being a good new grandfather. How much should we charge him, Terry? I will talk about it. Announcements. There's a few announcements that are coming up. There's the California Forgotten Children, it's a screening if you're interested. There's a P.
No, goodbye.
There could be a fine, John. You asked for a bonus. Please, now let me just. You lost your bonus. So please, everybody, please mute your phones right now.
For dinner tonight.
I'm sorry, you're gonna have to start. Everybody turn off your phone. Or we're gonna confiscate it at the door. Okay. So there's a few things. There's a Peace Chair Fellowship dinner. There's a Pathway to the Rotary Leadership. But there's a couple other things. The district training is August 10th, and August 17th is the district breakfast. I'm going to encourage everyone to support me. Let's get a table down at the district breakfast. It is at the City Club, and it's an 8:30 to 10. So it's an easy thing. Our club will pay each of you to be there. So keep that in mind, and you will hear from me again. One other thing that was suggested, the Seaside Splash and Dash at the lagoon. We have never participated, or we have, I don't remember. I think it would be a good idea for social. I think if somebody will build a boat, I'll row it. And I don't mind sinking, by the way. But if not, we can have some fun. Maybe we'll have I know Martha was telling me that she hosted a bar. So maybe we'll go down and figure this out. But it's a nice activity for us to be involved. Today, I have to have the rest. Yes.
Suggested.
I want to introduce our program today. Dr. Michelle Brones.
Is it Michael or Michelle?
Michelle.
Michelle.
Well, okay.
It's a double
Yes,
A.
I didn't check that. It's Michelle. Michel. And so Dr. Michelle is a board certified plastic surgeon. He's on the American Board of Plastic Surgery, American Burn Association member. He's been in private practice till 1998 to present. I mean, his resume is beyond. So I think it would take me 10 minutes to really do an introduction to you. But I think here's what everybody wants to hear is you, not me. So in that regard, everybody, let's welcome Michelle. Yes,
Thank you very much for inviting me. Here we go. I'd like to keep this open. So if you have any questions as we go along, please raise the question. Because then later on we forget and it's better to have an interaction.
Yes.
From
Hi, Michael. Did you have a question?
Like, another of my name, I was born in France, hence my name is Seoul. And then my family moved to Argentina. I grew up in Argentina. I went to medical school in Argentina. And as I was finishing my medical school, some of my classmates were toying with the needle and the stones. Hold on. Michael, everybody knew.
I knew.
Wow. So some of my friends were toying with the idea of coming to the States. And one particular friend of mine, who I was very close to, was very influential in, I wouldn't say convincing me, but in helping me. At that time, I did not have much money. And of course, you had to come to the States to interview with the different hospitals to get a job. So his family helped me. They lent the money. And we came together to the States. We applied to the same hospitals and we were admitted to the same hospital. And we started our career, of course, then he went into cardiovascular surgery and I went into plastic surgery. we were originally in Baltimore, and then I came here to UCLA, where I completed my plastic surgery. Now, when you think about plastic surgery, is what I thought at the time about plastic surgery, that I would be doing basically cosmetic surgery, right? Facelifts, tummy tucks, breast surgery, that type. But as it went, I really went in a very different direction. When I started my practice, as soon as I finished my residency here at UCLA, I went to work to a local hospital in Sherman Oaks, who at the time had the famous Grossman burn center. And as I started to work at the hospital, the chief of the burn center came up to me and said, Michelle, why don't you come and work at the burn center with me? And I said to him, well, I'm not sure I want to do that type of work because, of course, it involves working with the opposite type of patients that I envisioned I would be working with, instead of working with nice, beautiful ladies, right? I would be working with people that have been injured in the worst possible way. Finally, he convinced me to at least give it a try. He said, come for a couple of weeks, see if you like it. If you don't like it, you don't like it. So I went to work with him. His name was Richard Grossman, the founder. And I loved it. Not so much the work, but working with him. You know, sometimes when you get in a relationship of a mentor and a mentee, it works in a very special way. And we clicked. And the more I started to work with him, the more I enjoyed the work. And basically, ever since, I've been involved in the treatment of burn victims. I'm going to talk a little bit about burns and what does it involve. I'm not going to try to be gory about it, but of course, burns are a difficult injury. Basically, the burn center that Dr. Grossman and I worked at was and is the largest private burn center in the country. It's very famous in burn circles, and it's the burn unit where all the firefighters in this area go to. It's the go-to burn center. Basically, in a burn center, we don't treat small burns. I mean, in order for you to be admitted to the burn center, you got to earn the quote-unquote privilege of being admitted to the burn center, means that you have to have either a different type of burn injury, an extensive burn injury, or a burn that involves your face. So we would get patients from all over the area, and they would be flown to us by helicopters. The burn center had a helipad, so the helicopters would come in with the victims. And Dr. Grossman and I, we were on call 24/7. So it would be a very common occurrence that I would be having that dinner with my wife, and I would get paid, and I would have to rush to the hospital to receive the patient that came in by a helicopter. Once the patient is admitted to the burn unit, then they go through a routine which involves, number one, pain medication, because burns are very, very painful. Like we all know from just getting a sunburn, it's extremely painful. Now imagine if you are extensively burned and deeply burned, what happens is that all the nerves that are normally protected by the skin are now exposed. The nerves are raw, it's like electrical being totally exposed, so the patient suffers from a tremendous amount of pain. So the first thing that is done is provide the patients with IV morphine in order to take care of the pain. And then the patients have to undergo dressing changes twice a day, which are quite painful, and for which again they gain pain medication. Now, burns are a very different type of injury than any other injury. let's say you get in a ski accident and something happens to your knee or you fracture something, the orthopedic surgeon will come, they will fix the fracture, you don't see anything, that's it. But with a burn, the injury never leaves because you get a scar. If you are burned, you have a scar. There's no way to avoid it. And unfortunately, many of the scars that happen in burn injury are in areas that cannot be healed. Hands, face, so it's a particularly type of injury that has a very large emotional component. We saw all types of burn injuries like scalding, flame, electrical, chemical injuries, many types of injuries in which jealous partners will throw acid at the partner, and then the patient will be totally burned with acid on their face. So there are many those types of injuries that is not only a physical injury, but an emotional injury that sometimes is more important than a physical injury. After they go, the dressing changes, then the patients are taken to surgery. Why surgery? Because you have to clean them. But the cleaning of the burn is very painful. It cannot be done just by bedside. Consequently, we take the patients to surgery, usually twice a week. Monday, Thursday, Tuesday, Friday, Wednesday, Saturday. The burn center is a 24/7 institution. So you take it twice a week to do the cleaning. And of course, with the cleaning, this is associated a lot of bleeding. And because of that, they get a lot of transfusions. So of course, when we were dealing with the issue of AIDS, there was a problematic because we could not get enough blood. So the treatment and all that had to be performed very carefully. And then once that is completed, they all get skin grafts. You may ask, what is a skin graft? A skin graft, we will take skin from the normal part, the unburned area, and place that skin in the burned area. Because basically you have to cover the burn. But the burn can only be covered with the patient's own skin. Your brother cannot give you skin, your mother cannot give you skin. You have to give your own skin. Of course, let's say you're 90% burned, you have no place to take skin from, so you die. So those are the challenges that we will face day in and day out, and the challenges that every burn center faces. Besides that, many of the burn victims are involved with other injuries, car accident, a helicopter crash, an airplane crash. Not only they burn, but they have head injuries, trauma, internal trauma, fractured bones. So it's a multi-trauma type of situation. But anyways, they go through the procedures and they go through the skin grafts. And the patient would stay in the burn center 1 month, 2 months, 3 months, 4 months, of course, depending upon the severity. Once they leave the burn center, it's just the halfway. Why was it halfway? Because once we do the skin grafts, and once all the areas are covered, the problem with the burn scars is that they produce not only scars, but the joints. If you have a burn around the elbow and your knees, the joints will tend to contract. The burn wound closes itself by decreasing its size. So you pull in order to close the wound, even though you put a skin graft. Consequently, many of those patients will leave the burn units with what we call contractures. The elbow is contracted, the arms are contracted, the knee they cannot move. Consequently, they have to come back. And when they come back, we now go to the second phase. The first phase is what we call the acute phase. And now we go to the second phase, which is the reconstructive phase, in which they will come up for 2, 3, 4, 10, 20, 30 surgeries, depending upon the severity, and in which we will be working in different areas in order to reconstruct and to bring back to normal as well as we can. We can never bring it back to normal. Once we burn, we burn. But we can make it look as good as possible. Never perfect, but as good as possible. And that is where the patients have to go through physical therapy, occupational therapy, psychological intervention, pain management, and this and this and that. And after all of that is done, you still burn vigor. You've earned that in a way and never goes away. So it's not like you've had gallbladder surgery and you're fine and that's it and you forget about it. Burn, always, every day, they get up in the morning, they look at the mirror, they burn. So we have a very, very acute intervention, psychological intervention to deal with that. Of course, an emotional intervention, the only thing they can do is ameliorate the pain, but certainly never goes away. So those are the phases, and I did that for a long time. And the same way that I went into burn surgery, at some point I decided that I wanted to do something different. Not because I didn't like what I was doing, I loved it, but the quality of life that I had with my wife and our young family was really difficult to sustain. We weren't 24/7, I was in a 24/7 situation. Many times my wife was left by herself, we had young children, and so we kind of thought about what could I do that was different. So for the last few years, I've been doing something different, still related to burn injuries. I don't do surgeries anymore, because surgeries is a 24/7 occupation. What I do now, related to burns as well, is that I assist many of my patients and many new patients to deal with the legal maneuvering that comes along with burn. Every burn patient gets attached to a lawsuit. Why? Let's say you were burned with scalding water and an apartment in which you're a renter. Many times the issue is that the hot water heater is set too high. Consequently, you get burned when you take a shower or when you take a bath. Or let's say you were in a car accident and there was a crash, flame, and you were not at fault. Or let's say you were in a helicopter that went down. Let's say you were in the Grand Canyon being a tourist and the helicopter went down. Or let's say you were in an airplane that went down. All of those people get legal representation, and every case needs what is called an expert witness, somebody to come and explain to the jury the same way that I'm talking to you about what the patient went through, what are the scars at this point, what needs to be done, what will be the cost, and what are the disabilities, if any, they always say it one way or another, what are the disabilities in the future, so they can get proper compensation. So even though I'm not working in the surgical aspect, I'm working in the aftermath aspect with burn victims, and I do that on a daily basis. Because believe it or not, there are many burn injuries, especially in an industrialized city like this. There are many burn injuries, burn injuries, and they all need representation. So basically, that's me. That is short. So if you have any questions, please go ahead.
How much typically is, when you're talking about compensation, how do you figure that out? Because my mom was in burn.
Oh, I didn't know that.
She was in a bath at third degree from the leg down to the ankles, and she had 4 skin grafts. I'm wondering, she had good insurance, thank goodness, but how do you determine when you're looking, they're saying, all right, how much is this going to cost us?
Did she sue?
What? Oh, yeah, she sued the insurance company. She got it.
The way that it works, of course, I'm the expert from the medical staff. The case, of course, is managed by the lawyer. And basically, all of these cases, they have a history. So what the lawyers do typically, they look at what were the compensations in similar cases under similar circumstances. So let's say they would say a third-degree burn in a 60-year-old woman that affected both legs and needed 3 or 4 surgeries. And now with AI, it's very easy to do that. You just input as much as you can all the details, and they will come up with a range. It's like looking at zero and you see what is the range of my house. Well, it's the same with this. They give you a range. And of course, then, depending upon the circumstances of the case, there's always other circumstances. Were the people that caused the injury negligent? Did they know about? So then you have to add to that punitive damages. So the damages that are related to the cause, and then damages that are related to the punitive damages in order to, like the name implies, to punish the individual that produced the injury. Basically, that's it. Yes.
And the skin grafts, the donor site, is similar to a burn, isn't it? You're taking off the skin.
Is correct. Basically, the best way to think about it, the skin is like a 10-story building. Think about that. When you have a burn that is, let's say, second-degree burn, burns are called first degree first. When you have a burn that is a second-degree burn, the upper 4 to 5 floors are gone. And then you have to replace. You cannot replace with 4 or 5 floors. You replace with a skin graft that gives you 1 or 2 extra floors. Now, the area where you took the skin graft from, typically the thigh, you take those first 1 or 2 floors. So now that area is left with 8 floors, and you put 2 floors in the area that was burned. So in answer to your question, yes, if you have a burn, let's say that is a 40% burn, if you add now the areas that were used as skin grafts, now you have like a 60% burn, because all of those areas do not have the other floors.
What's the status of using lab-grown skin?
Nowadays, we use very much cadavers, like the name is like or people that are, but those are temporary. So you can use it for a while, but eventually you have to replace. The new technology, like it implies, is to culture cells from the affected individual and then grow the cells in the laboratory. Takes about 3 weeks. What you get is a very paper-thin layer. So going back to that 1 floor, you will get like 1/10 of a floor. So you can put it, but it's very fragile. And you will do that in cases like, for instance, we talked about the 90% burn that had no place to take skin from. In that individual, for instance, commonly, we would take it from the scalp, if the scalp is not burned, and send that to be grown. It takes 3 weeks. In the meantime, we will put the cadaver in the middle. And then when it comes back, we will put those culture cells that will give it coverage, but very thick, it's like very, very thick. Yes.
Mr. Dell, I thought you said earlier in your talk that if somebody had a skin graft, that it was only their own skin that would take.
Correct.
How could you take one from that or put it in?
The reason for that is because a burn is like having an open door, right? It's an open door in which bacteria can come into your room, into your house. With that open door, bacteria can come into the patient, and the patient will get infected. And if the patient gets septic, he will die. So what we have to do, we have to close the door. We close the door with the cadaver skin, but that door cannot be kept closed forever because the cadaver skin doesn't take. Eventually, it will dissolve. So that gives us time that we can get the better skin for a burn.
If you have Medicare and you have a serious burn, is that pretty well covered, or do you need a supplement, or how does that work?
You never have to try. Covers, my understanding is that it's up to $1 million per patient. Now, if you get a serious burn, that's gonna be gone quite quickly. So you better get supplemental insurance, right? Shield or grow to add to that Medicare. But unfortunately, Medicare has a seal. It shouldn't, but it does.
Your center at UCLA, I know when you were working, is that where your burn center is?
No, UCLA doesn't have a burn center.
Oh,
No. The only burn centers in LA are USC, Grossman Burn Center in the Valley, and Torrance Memorial in Torrance. Those are the only 3 burn centers.
Where did you?
Grossman Burn Center in the Valley.
And that,
Michael Jackson, Bird Center, something like that.
Gone.
Just like.
It is gone. Yeah, but it was. That one that Daniel Freeman. Overseas. Yes.
So when you're dealing with lawyers, can you tell the difference between someone who's causing self-harm on purpose versus someone who's to trying to sue somebody versus someone who truly is accidental?
I think that if you're going to harm yourself in order to bring a lawsuit, let's say, I don't think you would choose being burned as the way to do it. Maybe it's better to get a fracture or to do something else, but I've never run about people that did that in order to start a lawsuit. And we've dealt with very few suicidal attempts by getting burned. In my career, probably I saw only 3 people that did that trying to kill themselves, but there was no legal fault, but just trying to kill themselves. And they succeeded. Yeah.
I'm very interested on this pivot that you made from going after one area of medicine, which was cosmetic and was elective and dealing with beautiful people that want to look like, you know,
I love it.
something. And then going right to traumatic victims that are involved, that, you know, involuntary, don't want to be there, and going through tremendous pain. You know, that was a 180-degree pivot.
Okay, I'm gonna tell you a story that my wife doesn't like for me to tell, but I'm gonna tell it with your permission. This is you, with your permission, yeah. So when I was a very young resident, Baltimore, fresh from Argentina, fresh from the Baltimore, I was invited by the chief resident of the hospital, Big Honcho, to his house. I didn't understand why he would invite me, except for the fact that he was from Venezuela and I'm from Argentina, so we were fellow South Americans. So he invites me to dinner to his house. So I put my best clothes and good, and I go to his house and I knocked at the door and I open and he welcomes me and say, hello, this is my wife. Good to have you here, this and that. We talked for about half an hour. And then he said, let's go have dinner. It just so happened, says that my mother-in-law is visiting from Venezuela. I said, great. So we go to this dining room, the dining area, at a table with 4 chairs. One for him, his wife, myself, and the mother-in-law. And I noticed that the lights had been totally dimmed. You could hardly see what was in front of you. And I didn't know what was going on. And all of a sudden, and chief resident says to me, and now let me bring my mother-in-law. So the mother-in-law comes and sits right in front of me, and I looked at her, and I couldn't believe my eyes. She had been horribly burned by a jealous lover in Venezuela that knocked at her door, and as soon as she opened the door, threw acid at her face. Horrible burn, and she was visiting to come to Johns Hopkins, Baltimore, to have burn reconstruction. She had no eyelids, no eyebrows, no nose, no ears, and no lips.
Jesus.
And the face was like a movie, like a horror movie. And then the chief says to me, "Well, would you like an appetizer?" So I tried to go to that dinner as fast as I could, and I had nightmares for the following 6 months. And I say to myself, that's one area I'm never gonna be involved. I'm never doing burns, no matter what. God had different plans. But that's the answer that I never wanted to do burns, never, especially after that. But it just so happens that sometimes it's not what you think you're gonna be doing, but what happens in life, you know. So that's what happened. And I ended up doing burns for all my career. I still, see burns patients on a daily basis. And yes,
As a general citizen of the city, like, is there any action you can take, to be, I don't know, like, advocates or just like providing sort of relief to the victims or any sort of like awareness action to?
well, my wife always reminds me of the fact that the burn center always has an outreach program, especially around 4th of July, to tell the people not to play with fireworks. We see many victims that come to the burn center after fireworks. They seem innocent enough, but they're not. So, and the burn center is constantly going to schools, trying to, but, burns, in reality, burns is, in answer to your question, most of the burns are related to two things. Number one, I would say carelessness. And number two, I would say ignorance.
Say what?
Ignorance. Because burns in general are, we call it a social disease. It affects mostly people in the lower socioeconomic class. You never see a CEO coming to the burn. You never see people that are highly educated coming to the burn. You always see people that are too busy in their lives. They have many children, life is hectic. And people that are working people and they have lots of things to do and they do not follow the safety instructions. For instance, people that work, let's say electricians that work with high voltage, they're supposed to wear fire retardant clothing, shields, gloves, but many times they rush and they're not being careful. And that's what injuries happen. Carelessness.
Yeah, you get something like a minor burn, like a hot spoon or something like that. What can they do with it? Should you put cold water on it?
Cold water.
Cold water. Is there like a squat, like a
Yeah.
vitamin E?
If you burn, we usually then use a cream that's called silver. It's already out there, silver, but cold water. If you have silver, just put Neosporin.
And another question.
Go ahead.
Now,
Okay. Yes.
Have you worked with UCLA's operation event? No?
What is that?
Well, I was curious when you said that because they said it originally started for burn survivors, for veterans that were.
What is it called? You see what?
Operation Mend.
Okay, I was just curious because I thought they must have some kind of bird center because they had that. Okay.
UCLA never had a bird center.
Yes.
We're back again.
A number of years ago, someone sued McDonald's for drinking coffee that was too hot.
Right.
Now, was that a burn center thing, or was that just a, hey,
Well, the, interesting that you bring that case, there's been many copycat lawsuits after that. And the argument is always, what is the appropriate temperature for coffee? Right? Most people like coffee hot. Right. And most people, when they go and buy coffee, they like it hot. So McDonald's was sued because they say that the temperature that they kept the coffee was too hot, was 180 to 200, which is too hot.
Yeah.
And they say that normally you should keep it at about 150, 140. Of course, McDonald's said, nobody's gonna buy our coffee, we give it at 140, 150. So that case was kind of a stunt case in which the lawyer was smart and they got that money. And after that, they've had many cases suing all kinds of Starbucks, always been sued, all of those people. But all of those cases do not get the compensation that original case got. And the other thing that is commonly said is that when you put the lid on the coffee, many of the argument is that the lid doesn't really close enough. So when somebody squeezes the coffee, they come off. But of course, it depends how hard you squeeze it. If you squeeze it hard, no matter how good the lid is, it's going to come off. So, but all those cases are because of that.
Somebody else have a question?
Just in case I want to say, does anybody here uses vaping? Smokeless cigarettes, vapes?
Still being,
Okay, there's been a really great number of burn cases associated with that because the battery of the smokeless cigarette explodes. So there've been lots of recalls and all that. So if anybody you know vaping, don't stop.
Hey, 1 second.
Yeah.
Is there anybody that's on Zoom that wants to ask a question? Raise your hand. No? Okay, well, now you stay right there. You stay right there. I want to thank you so much. What a wonderful speaker. Okay, there. Oh, very good.
Thank you very much. Thank you very much.
Okay. We do have about 10 minutes. Is there anything that you want to discuss right now? That have sort of an open, yes,
So Benjamin,
yes.
for the November event, the foundation dinner,
Yes.
and according to the website, tickets are almost gone. So I don't know if we're getting a table or if you've got a group that wants to go. But I think if you want to sign up for the foundation dinner, you should do something there.
So everybody, the foundation dinner is going to be at SoFi Stadium. And let's get a table. I know he's expecting us to bring some kind of a basket there.
Already on it.
You're already on,
I
okay.
need a couple bottles of wine and I need at least 2 tickets to a UCLA event that takes place after November 15th.
Okay, so the wine is not an issue. I don't have any access to tickets. So I think Chris Gainer might, Tom might,
Bill Rowan.
Bill Rowan, yes. So how many people are going to go to the foundation dinner?
when is that?
November.
Like the first Saturday or something in November, I think.
It's a Sunday, I think it's a Sunday afternoon. It's not an evening. So it's at SoFi, it's a SoFi Stadium, and it'll be a nice, if you haven't been there, the only time that Susan and I were there was saw the Rolling Stones. And it was it was a good excuse to go and see that place. The Stones were at, but, yeah, they should retire. Yes, John.
I may go if I don't get fined anymore.
Well, John, if you keep your phone muted, you won't be fined. And if you show up with your smile on your face, it'd be hard to find you. Anybody else have anything else that they would like to talk about? Yes,
I want to talk about it.
yeah, let's talk about a table for the burn. So how many people, now again, I encourage everybody to go to this because it's a way of learning about road. Since we're gonna pay for it, all you have to do is have the time. And what's the date? August 17th, I think, I believe.
The foundation is November 2nd.
November 2nd is the foundation. So there's two things we're talking about. And we'll get you those dates. But put those on the date calendar. Just so you know, so Janet, do we have 100% participation in the survey? Do you know?
Not.
I have a bunch of them over there.
Yeah.
Okay, so, now I'm gonna send you Marcia, Terry, Chris, Ed, as well as Mike, a survey. You'll be getting the email. Please return it as soon as possible, because this is really so important to me. I, again, want to make this club what everybody wants it to be, okay? Anybody else have anything else? Because if so, if not, we're gonna adjourn the meeting early.
Oh.